No, firstly, thank you very much, Chris, for doing this. And I just had
No
like
problem.
a few questions that I wanted to go through to ask you about our experience together and just your thoughts on even just marketing in general. Firstly, have you ever worked with a marketer before we worked together?
No, I hadn't, to be honest, and I was probably quite naive to what actually a marketer was able to offer me as a dentist. So no, it was not something that I'd considered before.
Because what were your thoughts? Because I know in dentistry there's a lot of thoughts about marketers and there's a lot of stories and that sort of thing. What were your thoughts prior to just working with the marketer?
Part of me was a little bit skeptical because I see, particularly on my social media platforms, particularly Facebook, sometimes I see some marketing, advertisement of marketers helping dentists offering what I felt was possibly unachievable results. So I was always a little bit hesitant with that. Probably because, again, I wasn't really aware of the power of what you could do with your marketing strategies. So, it wasn't something I'd considered before.
Okay. And what made you made you go on to have the first conversation that we had together?
So it was one of your colleagues, one of my old university friends, Arnold, who's also a dentist, got in touch and said, "Listen, Chris, I know you're a little bit like-minded and I've had some really good results with this chap, and I think it'd be good for you to maybe have a look at as well." So, you always have an element of trust when somebody who's like-minded, is a good guy, Arnold, is recommending somebody. So there's already kind of some goodwill and some trust from that. So that was initially kind of how I became aware of your services.
Oh, okay. And what did you think about, like, let's say our first few conversations together before we even started doing anything? Do you feel like things were explained properly and that sort of thing?
Absolutely. I thought you were asking really good, thought-provoking questions. Initially, surrounding the type of patient that I wanted to bring into my practice and the type of patients that I wanted to treat. So I liked the way that you formed the initial strategy based on what I wanted to achieve with it. So I felt that the initial sessions were very thought-provoking. I felt that you were a very good listener, as opposed to just trying to throw a whirlwind of information at me. I felt that you were, somebody who actually was very good at asking the right questions, but most importantly, kind of listening to understand, as opposed to just waiting for the opportunity to get back in there on the conversation. So that was what, irrespective to some degree of the service that you were offering, what I bought into straight away was you as a person. So that was, really important for me because, I think processes can be tweaked and refined. But what was really important for me, that actually I felt that we had a rapport from the word go, and we built some trust between one another. So I think that was always important for me, irrespective of the service that you had to offer. The fact that you offered a good service extra was the bonus, I suppose.
Yeah, brilliant. Oh, thank you. Those are some really nice words. Thank you. And what problem were you trying to solve? So what were you trying to achieve actually? What did you through us working together?
So I was at a point in terms of not necessarily saturated, but I felt that maybe I'd personally exhausted the cohort of patients that I had at the practice in terms of exploring patients wishing to undertake some orthodontic treatment using Invisalign. So what I wanted to do was to be able to offer my service to a broader cohort of people. And you were well positioned to help me do that with the skill set that you have.
Yeah, brilliant. And how did you feel the communication was like between us, even when I first started asking for information and that sort of thing? How was that for you?
really good. And obviously we're in a period of time at the moment where everything's done virtually and digitally. Obviously we had a few initial conversations over Zoom. That's obviously carried on over kind of WhatsApp, email. But I think you've been very clear with what you've requested from me. You've been respectful of the fact that obviously we're in a busy kind of career, and times are quite hectic at the moment. So you were very accommodating, willing to kind of speak to me out of hours around my kind of clinic time. So you weren't restrictive in terms of when we could discuss and explore what we could do. So I thought your communication was very clear, and there was no kind of mixed messages in that sense.
Okay, brilliant. And what were you expecting before? So after we'd had all the conversations and we've set it all up, what were your expectations at that point of what would happen?
I think my expectations were of an unknown, really. I was just very curious to see what potential there was, having from your research that you did for the area that I work, realizing there'd been very limited marketing in the particular way that you do it, at the target groups that we'd kind of agreed upon. So I was very curious to see actually what would transpire from that. Knowing how well Arnold had done, if I'd have at least had one case come from it, I suppose I was really pleased. But actually you blew those expectations out of the water, and we created and generated a huge number of leads. You made actually me step out of my comfort zone, which was good, with starting to do those Zoom consultations, which actually is something that I will certainly continue with, and actually move beyond just using that for an Invisalign process. I'm using it now for a range of kind of discussions with patients, because ultimately, we need to evolve with the times as well as clinicians, that people don't necessarily work 9 till 5. People have got different working arrangements. At the moment, things are very difficult for people in terms of obviously comfort of coming out of their own home, being mindful of how exposed they are in society. So the ability to use Zoom for initial consultations of different complaints. So that came through the process. So putting me out of my comfort zone was something that actually, in retrospect, I was really kind of quite grateful that you did. So yeah, I've been, as I say, the expectations of it, I didn't really know what to expect. I was just very curious, but it's kind of gone above and beyond what I'd have hoped from a advertising campaign.
Yeah, brilliant. And what kind of results did you see? Did you actually see, like with the leads, good quality leads? Did you actually see people end up coming into the practice and have treatment or anything like that?
So yeah, it was actually very surprising that the leads that were generated were, on the whole, very positive, and we actually captured a group of patients who were actually well educated about their options, where the power in terms of branding that Invisalign has. A number of the patients that got from being a lead into a Zoom consultation were, again, as I say, well educated in terms of their options. Probably a handful of them had done some homework, had previously been to other consultations. So the questioning was quite direct and knew the specifics of what they wanted. So it was good to work with and communicate with a group of patients who were quite focused on what they wanted to achieve with it. So yeah, from generating tens of leads into I think in the end about 15 or so good valuable Zoom consultations, we've had at least half a dozen now commit to treatment. So yeah, great results.
Yeah, and how quickly did you start seeing results?
Oh, immediately, mate. Absolutely immediately, because again, the great thing that you did for me was you created the Calendly, you created the spreadsheet, the automated kind of things that you did in the background, created the notifications. So, my email was popping up left, right, and center with notifications about lead inquiries, and the data collection that we achieved with that was really good. So, yeah, actually, as soon as we kind of got the ad live and we got over the initial kind of pausing that Facebook placed on the advert, things went really well and actually generated interest very quickly.